Great. Thank you, Mr. Chair. Dr. Inglesby, you spoke about the potential for AI models to assist malicious actors in creating highly transmissible pathogens. This is obviously all the more possible given that we do not currently require screening for all gene synthesis providers. Senator Budd and I have a bill called the Gene Synthesis Safety and Security Act, which would help us conduct critical oversight of the industry and protect against misuse of these types of products. If we do not enact federal guardrails here, how would you assess our level of risk?
Senator, first of all, I just want to commend your leadership on that act and think that that is a really crucial step that we need to take to reduce biosecurity risks. I think the executive order goes some distance towards in the direction that your act laid out, but I think Congress could go further in requiring that all of those ordering nucleic acids in the United States abide by the same rule, not just those who are federally funded. But to your point, I think the problem that your act and the executive order has been trying to solve has been the possibility that malicious actors could order nucleic acids from a company in the United States and de novo create viruses that are now extinct, such as smallpox or something along those lines, which we, if released into the public, could create a pandemic. And it's a very clear, the industry is very in favor of regulation in this case, which is obviously quite unusual, but they've been very clear about that. Many of the best actors in the industry are already screening their customers and screening the sequences, but it's not a requirement. So the good actors are at a disadvantage. The bad actors are not paying for that or doing that work. So thank you for your leadership on that.
Oh, of course, thank you. Dr. Mandel, you wrote in your testimony that, and I quote, "Each patient's experience informs the care of the next patient by connecting the dots among every visit, treatment, and outcome." In many ways, this is the highest ideal of how our health system, under the best circumstances, good circumstances, how it should work. And certainly AI could be a great equalizer in terms of helping us to amass and analyze all and connect all those data points. How can we seize on this moment with AI to catapult our ability to utilize real-world data, but also building the guardrails that you've all been saying are necessary to ensure the security of the data? What is the number one concern you have in mind in terms of the use of AI to manage this level of data, this amount of data, and how should we be working to address it?
Well, I think there's two sides to this. One is the actual use of the AI to look across vast amounts of data that no clinician could integrate in their head, and to do that potentially even in real time in the clinic when a patient is before us. And there we need the guardrails to make sure that the AI is acting in a way that is accurate and beneficial, that's improving the value of care, and there are multiple levels of that kind of measurement. The second place where I think AI can help us is simply by being a burning platform of sorts. If you look at the COVID pandemic, there were some failings, but there were also some incredible successes of the community coming together and moving data to where it needs to be so that we could monitor the pandemic. And as the pandemic went on, we got better and better at it. And the collaboration and the enthusiasm for it was very different than what happened before. I do think that the COVID pandemic receding, hopefully permanently, we see some also receding of that enthusiasm for the kind of collaboration. I think that AI is the burning platform where we can actually try to move the data to where it needs to be to evaluate the healthcare system and to move towards the learning healthcare system, not just for AI, but for drugs, devices, procedures, surgeries, and that there's an incredible opportunity there if we seize the moment.
be an amazing concept to go from spending 18% of our GDP down to maybe 8 or 10% like the rest of the world. That's one way we could move in that direction.
Absolutely.
Thank you. I'm out of time, but I've got other questions that I will submit to both of you in writing.